Hall and the City of Berkeley's response to the COVID-19 pandemic. I'm your mayor, Jesse Adeguin, and I'm joined with our City of Berkeley Public Health Officer, Dr. Lisa Hernandez, and our City Manager, D. Williams Ridley. We're also joined this evening by the Director of the Department of Health, Housing, and Community Services, Dr. Lisa Barhus. Thank you all for joining us this evening, and thank you for your tireless work to keep our community safe. And I look forward to answering your questions tonight. Residents have the opportunity to submit questions on our website, and we received a number of questions, and we'll dive in. And any questions that we were not able to get to this evening, we'll certainly address at our next town hall. We are actually changing the day and the time of this town hall to better accommodate families and individuals that aren't able to participate on a Saturday afternoon. And so we are moving these town hall meetings to Monday evenings every 2 weeks. We did schedule today's town hall on Tuesday due to the Labor Day holiday, but we hope that this will increase our community's participation in this forum and our ability to get information out to Berkeley residents around our response to the COVID emergency. So stay tuned for information on the next town hall. And once again, I want to thank our city leaders for participating tonight. A lot has happened in the past 2 weeks, not just the ongoing public health emergency, the catastrophic fires that are raging throughout the state of California, and the worsening air quality that impacts us on a daily basis, and then certainly the record temperatures. We are working to address all of these different challenges with particular emphasis on helping our most vulnerable during this difficult time. And so tonight we're going to update you on our response to COVID-19, but we know that we also need to protect public health on a variety of levels, and to make sure that while we are addressing the ongoing threat of COVID-19, that we are working to mitigate the impacts of poor air quality, the ongoing threat of wildfires, which we face here in Berkeley. We know in 1991, the Berkeley Oakland Hills was the home of a very devastating fire that destroyed hundreds of homes, and some neighbors lost lives. And we know in 1923, the fire went all the way down to Shattuck Avenue. So the threat of wildfire is a real ongoing threat that we face as a community. And wildfire season is not just isolated to a few weeks, a month now. It is a year-long season. And with climate change and warmer temperatures, it creates conditions that pose our community at risk. And so what we are seeing in Sonoma, Napa County, and Santa Cruz County is a risk that we face in Berkeley. And we are working hard to manage vegetation, to reduce fire fuels, to improve evacuation routes, and to improve community preparedness so that we are prepared in the event of a wildfire and can keep our community safe. And this is an ongoing priority of all of us here in our city administration. We also know that it's been roughly 6 months since the shelter-in-place order went into effect, and it has impacted all of us. It really feels like a lifetime ago that this pandemic started. So much has changed in our world. So much has changed in our city. But I just want to once again take this opportunity to thank the Berkeley community for your dedication and your commitment to protecting you and your neighbors. I am always so incredibly inspired by the compassion and the selflessness that our community has shown, the concern for our most vulnerable, for our frontline medical workers, for our essential workers, and our small businesses. And we will get through this together, but we need to stay vigilant. We need to support each other, and we need to shelter in place. We need to remember to wear a face covering, and we need to take seriously the public health guidance that has been issued by our public health officer. So let's continue to stay vigilant. We are making progress. There's a lot more that we have to do. And we're particularly concerned about the winter months when we have the combined effect of the flu season and COVID-19. So that's certainly something that's on our minds as well. So with that, I'd like to now turn the floor over to our City of Berkeley Health Officer, Dr. Hernandez. And thank you once again for participating. It's not often that community members have this level of engagement with the public health officer, and just really want to thank you for your ongoing work. Dr. Hernandez, if you can give us an update on the number of cases in Berkeley and some of the statistics, any modifications to health orders that have occurred, and any other information you'd like to share with the Berkeley community. And I know Dr. Varghese may join in and help provide some additional information as well.
Great, good evening. I'm trying to switch gears to an evening town hall instead of an afternoon. So good evening and happy Tuesday. Thank you, Mr. Mayor, for mentioning some of the things I wanted to mention as well. And I'll just focus in on infectious disease because I worry about the pandemic and flu season intertwining and looking at the impacts of both of those diseases that have similar symptoms. So one of the differences between the two is there's a vaccine on the way. So I do want to encourage people to get vaccinated. The question may come up, when is the best time to get vaccinated? I said, and my answer would be as soon as you can, because we know human behavior kind of modifies our responses. So if you're thinking about it, you should get vaccinated if it's available. Some people talk about delaying the vaccine for later in the season when the peak occurs. But my feeling is as soon as you want it, get it. So let me go into the numbers and talk a little bit about some of the topics you mentioned in terms of what's our data looking like, what our health officer order looks like, and then some of the other pieces that I think the community might be worrying about or wondering about. So in terms of Alameda County, the cases in the county, not including Berkeley, now are at 19,350 confirmed cases of COVID-19 with 300 deaths. City of Berkeley cases now are at 573 cases with 6 deaths. And then in terms of our tests reported and performed on City of Berkeley residents, we are now at 36,569 tests performed and reported to us, with a 7-day average of about 423 tests per day. And as you may remember, the target that I wanted to set was at 245 tests per day. So we're comfortably over that target. And the percent positive is at 1.8% positive. So that number is a number that looks at, of the tests that are performed, what percentage of those tests are positive. And we're below 2%, which I like. What I also like is that percent positive has been decreasing over the last few weeks. On that vein, let's talk a little bit about what we're seeing in terms of our cases. That number lately, last week especially, we were seeing some increase in the number of cases per day. We've been hovering at about 4 to 5 cases per day, with 2 days last week with peaks of 9 cases reported per day. So that worries me. Over the weekend, it was a little quiet, but I think we'll see those numbers potentially pop up. One, because there might be a reporting lag in those in the data, and 2, because as we've seen in other holidays, we've seen cases increase because of social gathering. So that's one of the things that I do want to point out, is that that's one of the factors that we see with our increased cases, is that we're seeing social gathering as being one of the factors. We're also seeing cases occurring in multifamily homes. So homes where there's multiple families living together, either intergenerationally, or families that are, or individuals that are coming together and living in a house or an apartment because they need to live together because of cost of living. In terms of our hospitalizations as a county, I'm seeing that the hospitalization numbers are decreasing, which is great news, because that shows us the severity of the disease, and also allows us to feel a little bit more comfortable in terms of hospital capacity and impact on the healthcare system. So we are seeing a decrease in the hospitalizations. And as I mentioned, also which is reassuring, is our percent positive rate. That's actually decreasing not only for Berkeley, but also slightly decreasing for Alameda County as a whole. One of the things that I want to say when we look at our data, we have to look at it as our region, because we're not an island. Our numbers might look good in the middle of Alameda County or surrounding, but our surrounding areas, which are Contra Costa and Alameda County, their numbers don't look as good as ours. And we have to consider those jurisdictions, because we know that most of us don't live and work and stay in Berkeley. And we know that people come from other places to either work or to use our services or shop or what have you. So we know that we have to look at our risk on a continuum in terms of our risk. So even though our numbers are down, which is great, our risk isn't diminished, because the risk is dependent on our disease presence in the other jurisdictions. That being said, we did see, because we saw improvement not only within Berkeley, but in Alameda County, there were new health orders that were effective last Friday on the 4th, both for Alameda and for Berkeley. And they're pretty similar in terms of what was allowed. And the orders were created to align more closely with the state's orders and with what was allowed based on what tier we're in. And I will talk a little bit about the tier system in a second. But in terms of what's allowed, indoor haircuts are now allowed to operate with COVID precautions. You're also able to ask for a haircut outside if your hairdresser or barber has that capacity. Salons, including nail salons and waxing, must still continue to operate outside, but you can get your haircut inside. Libraries for higher education are allowed to open. So Berkeley Community College or UC Berkeley and any higher education institution within the city of Berkeley can open if they'd like. Outdoor dance classes are allowed to operate, and that also has to be aligned with our non-contact fitness classes. There was some guidance about fitness classes that we released a couple orders ago, and the dance classes are now following those same restrictions and precautions, so they're underneath that. Entertainment centers, so shared play entertainment centers can open for mini golf, batting cages, driving ranges, based on the state guidance. However, shared play structures such as the ball pits or the bounce houses and playgrounds are not allowed. And the reason for that is because those areas are high touch areas and also encourage congregating. So we don't want to increase the risk of exposure with those activities. The other thing that was released in our order and was effective on the 4th was guidance about youth activities, schools and youth extracurricular activities, where the allowable cohort size is for 14 youth and no more than 2 adults. So you can have a cohort of 16 total for any organized and supervised care environments, which includes distance learning hubs, youth recreation programs, before and after school programs, and day camps. Also allowed are in those cohorts the use of balls and frisbees and other shared objects. They can be shared within members of those cohorts, and as long as they're cleaned between each cohort. So after a cohort uses it, another cohort can use it as long as they're cleaned and following the precautions. The other thing that was released actually earlier than the 4th was information for all Alameda County schools, both private and public, where all the schools are required to submit a readiness questionnaire, and that is submitted to Alameda County Health Services Agency, and then it would be reviewed by Alameda County Office of Education for completeness, where the questions are basically asking about the school's readiness for in-person instruction. So that means whether you're ready to do instruction now, if you were able to apply for what's called a waiver for elementary schools, or if you're thinking about opening in person once we're allowed to open based on our tier. The questionnaire asks questions for schools to see what their readiness is and what supports they'll need from public health. For the schools in City of Berkeley, Alameda County Office of Education will send those questionnaires to us so we can work with the schools and have that assessment as well. So I just wanted to give that brief update on the school guidance. And we're partnering as usual with Alameda County for all our orders as well as the guidance for schools and childcare. The other thing that was released last week was by the state and the governor, which is the blueprint for a safer economy. That switched the system from what we may have remembered as the county watch list to a tiered system where there are 4 tiers as opposed to being on or off the watch list. You have 4 tiers based on your county's risk and disease transmission. So there's tier 1, which is widespread, tier 2, which is substantial, tier 3, which is moderate, and tier 4, which is minimal. So tier 1 is the most restrictive, and that's similar to a county watch list. As the watch list, it's based on county jurisdiction as opposed to local health jurisdiction. So City of Berkeley will be folded into Alameda County's guidance and restrictions based on the disease transmission as a county jurisdiction as a whole. I feel that's a good way of following these restrictions because, as I mentioned earlier, we're not our own island in terms of our risk for disease transmission. So as it stands now, we are still in the widespread tier, which is tier 1. We are allowed to have the restrictions relaxed based on what I just reviewed in terms of our order. There are some things that we are being a little bit more restrictive on in terms of not allowing movies to occur outdoor or indoor, or malls, and a couple of other restrictions. But overall, we as a county and a city jurisdiction have allowed most of the activities in terms of the widespread activity tier 1 allowances. In terms of testing, as I mentioned, we continue to be at our above the target that we need to be and that we set as a Bay Area in terms of our testing volume. We continue to provide some testing within the city. We have the Optum site, which is a site by the state that is supported by City of Berkeley staff. We are also still reworking and our pilot with Curative, which is a site that offers a different form of testing in terms of how the test is administered. It's not a NP swab or an OP swab, which is the swab that goes deep into your nose or deep into your throat. It is a different swab that swabs in, that you can swab yourself in your mouth. So we're reworking that pilot with Curative, and we're also working to see about other options. The test site at 6th and University is not operating. In fact, the lab, IGI lab with Cal is having some issues with their supply, and we're hoping to get that back on target, and then also reworking opportunities for testing and focusing our testing on more of a continue to do more of a targeted equity-based testing that we had talked about before. So that's something we will restart as soon as possible, but as you see, our numbers still remain in a very comfortable place. I talked a little bit about schools, and we continue to work with BUSD on schools so that when schools are able to safely reopen in person, that that not only students but staff and teachers are all protected, and we have plans and our processes in place with Berkeley Unified and all the other schools in the city. The last thing I wanted to talk about very briefly is UC Berkeley. As mentioned, we have a close relationship with UC Berkeley. About 2,000 students are on campus. They're doing continuous testing with the students. There was a few students that tested, about a little over a handful tested positive the first round. The second round, the testing is still in process. I do expect to see more positive cases with that testing round. Some of it is because they're in a new situation, and we know that the university has a good process in place. We work with them very closely. We're also working with the campus in terms of supporting the response in terms of students that are also in the city, but not on campus, in terms of ensuring that they are compliant with the public health orders, as well as having access to tests. So I'll stop there, and I look forward to answering any of the questions that are directed to me.
Thank you very much. I'm going to go to our city manager, and then I'll come back to Dr. Varhus to see if there's anything she also would like to report on before we go to questions. So I now want to turn the floor over to our city manager, Dee Williams-Ridley.
Thank you, Mr. Mayor. And it's good to be back on the screen again. I think the last time I was here with you was in early July and with the community. So I'm really glad to be back. So just giving a quick update, I generally like to go over how we're progressing around support for people who are unhoused in our community and any updates around specific things that are happening in our city. So currently our city facilities, some of them still remain closed. The city has not completely reopened. Things are still completed on a case-by-case basis. When you need services, you have to reach out, and we actually schedule time for folks to meet with you, especially on those specific issues, such as death certificates or different types of licensures or permits. So we're still here. People are still working. The majority of our staff are still deployed as disaster service workers, and they are also deployed to our EOC. And then some are back in doing a lot of the business of the city. So our parks workers are still out there. Our waste management team, they're still out there. So we still have a number of folks that are still working every day in the city. So, and excuse me for that. So as of today, going back to our unhoused, as of today, we have 68 of the 69 rooms that are occupied in the Alameda County run operation, the Safer Grounds hotels. That's the Roadway Inn and the Quality Inn. 68 of those beds are full, and we have one vacancy there. Most of the residents in these hotels are Berkeley residents. And that's the result of some very diligent and patient work by our homeless outreach team and our staff. And kudos to Dr. Varhus, who's on the call with us today, for overseeing that team and that work. I really appreciate all of that team's services. In addition, our EOC continues to support those staying at the trailers and houses and the home that encompasses our Berkeley respite sites, which have about 16 out of the 22 spaces occupied. The expanded shower program, we continue to see clients utilize that service. Willard Pool, for example, we had a total of 206 clients, 34 people per day. And then West Campus Pool, we had a total of 135 clients, and we're averaging about 19 clients a day. So people are using the facilities, and we're very happy that we're able to provide that service to them. So on another note, one of the most important things that we can do right now as residents and businesses is to continue to urge people to sign up for AC Alert. And this is our dedicated emergency channel to reach people over text, phone, and email. It's important that people sign up for these alerts, because with fire season fully underway, we're encouraging those who live in the hills, especially, to use that reference online at the City of Berkeley, the wildfire evacuation page. It goes into details and guides residents through how they can prepare their households in advance, what to do when a fire threatens, how to evacuate, and what to do when they're returning home. The more people prepare in their individual homes, the better we'll be able as a city to help those that are in need. So I encourage folks to really make sure that you're signed up for AC Alert. And the number, if you were to be called, the number would be start with a 925 number. So make sure that you sign up and you don't delete that phone number or block it. So I'm going to read that phone number to you so that you have it. If I can find it here. Let's see. I'll come back to it if I can find it, but I just want folks to know to make sure you sign up for AC Alert. And it's also broadcasted on radio at 6:10 a.m. So make sure that those are your access points. The next thing I want to try and give a simple update on is Fema. Of course, there's lots of information on the Fema website, but there are also some community innovation stories that I think those stories kind of motivate people, and it highlights innovative ways that people have found to help people around them, and they're really useful. So if you can go on the city's website, click on Community Innovation Stories, and you can see some details about that. Let's see, I think that's it in terms of the update that I wanted to provide. I think that our Dr. Hernandez has shared a little bit about what's going on with our schools, and I'll wait for the questions there, but we are continuing to work directly with our school districts. And I know there are a number of questions that you have for me, Mr. Mayor, but thank you again for hosting and inviting us to be a part of your panel. Thank you.
Thank you so much, Dr. Varghese. Before we go to questions, want to see if there's anything else you'd like to add about the city's work in responding to COVID-19.
Good evening, everybody, and thank you, Mr. Mayor, for inviting me. This is the first time I've participated in one of these town hall events, and I'm quite honored to be here. As a former Berkeley resident, grew up in Berkeley. All three of my children graduated from Berkeley High. I'm very honored to be here. And despite the fact that I have been in this position since essentially the first shelter-in-place order, I feel like this is the most honorable, meaningful time I can serve this city. So it is really, truly an honor to be here and truly an honor to serve. Just a few additional things before you get to the questions. I do want to say that all of the in addition to really working to fight this pandemic from a disease containment lens, all of the health, housing, and community services divisions have really scrambled to be able to provide critical services to those most in need. So for example, our aging service division has really ramped up over this period. And while we are not able to operate our senior centers, we have vastly increased both the amount of meals delivery that we are doing, with many of our staff delivering hundreds of meals a week, thousands of meals a week at this point. In addition, are doing critical case management services and trying to adjust our work overall so that we really can reach out to seniors at this time of isolation and challenge. Our mental health services transitioned extremely quickly to a telehealth model and continue to serve existing clients, and a couple of our adult clinics remain open to serve really mentally individuals with severe mental illness and provide medication and needed supports. And our public health division has continued to provide sensitive services to women and a variety of other public health supports, including registration and signing up for WIC and other services. So I want to assure people that our services we believe that these services that we've provided for many, many years are a priority for our city, and we continue to take them, to operate them in the best possible way in these times. I do want to add, I know there are some specific questions about schools and childcare, but I want to recognize that these are very, very challenging times for families. I know trying to work, manage your children's education, be the child care provider, and perhaps sometimes even not being able to rely on help from grandparents or elderly caregivers is very, very challenging. I want to honor that and let people know that we see that. We have many staff in that situation. We are all working towards that. And then to that end, with regards to schools, I can't stress how intentional our city wants to be around partnering with our school systems around being able to eventually allow for more in-person instruction, and also being able to troubleshoot a variety of barriers that it will take both for our schools to open and also for our children to access their education. We know that I myself come from a school health background. In fact, I'm a former employee of BUSD, and online school for some kids can work for a period of time, perhaps because they all have the resources necessary to access online education, perhaps because they just have that learning style that works okay with online education. But school is not just about academics. School is about socialization. School is about building relationships and learning how to be in relationships with each other. I know the district and our private schools are doing their very best, for instance, to implement online kindergarten, but kindergarten is not just about online instruction. It's about learning to stay in your seat. It's about learning the rules. It's about learning how to relate to other kids and adults, and that is very difficult. So I just want to stress that the Health, Housing, and Community Services Department really sees ourselves as a partner in being able to get our Berkeley kids, and they're all of our kids, back into school, back into learning, to provide the best possible opportunities that we can during this time. I just want to assure community that that is something that I hold very deeply. And we are working very closely with the school districts to identify ways in which we might just be able to work together to allow all of our kids, and especially those furthest from opportunity, to be able to have access to their education and eventually be part of a in-person environment. And then as a final part of that, I'll just add that testing, COVID-19 testing, is going to have to be a key component of that, in order that, so that, you know, schools don't open and close and open and close. We need to figure out together how to build a testing regimen that supports our city. And I've gotten a lot of questions from individual private schools and the district individually about, could I hook them up with this vendor? Could I hook them up with that vendor? And I want to say that from our perspective, this is a joint effort. We need to jointly figure out how we're going to work through testing together, so that we're not doing one-offs here and there, or that those that have resources or the ability to pay for tests for their teachers, staff, and kids get it and others don't. We actually need to approach this collectively. And that's one of our intentions in terms of really supporting our city moving forward. And that is the same for our businesses. It's really how we all together come together to move this testing. So that is something that our department is committed to working through.
Thank you very much. So let's now turn to questions. Dr. Varhu's kind of kicked off the sort of discussion around outdoor learning. We received a number of questions and comments around what the city can do to support our school district to create outdoor spaces for outdoor classrooms. Some of the comments noted that cities have shut down streets or parts of sidewalks and streets to accommodate restaurants. Can we work in conjunction with BOSD to get kids learning outdoors? And in addition, I'll just read this last comment because I think it kind of frames the whole issue. With COVID transmission levels low in the Bay Area, our abundance of outdoor space in Berkeley, the science confirming that outdoor activity is the safest during this pandemic. Why has the city of Berkeley not explored the use of outdoor classrooms for BOSD students? As a parent, I feel there's no urgency to get our kids back on campus. Even with the waiver for in-school learning recently available, the BOSD chooses to focus on distance learning. What distance learning is exposed is a large digital divide among our student population. And we've seen that this digital divide affects kids lowest on the socioeconomic level. we're honestly looking through an equity lens to get our kids back on campus through the use of outdoor classrooms should be a priority. So, and then moreover, there was another question around, are we applying for a waiver for in-person instruction? And if not, what is the scientific reasoning and evidence for why we're not? So Dr. Varghese talked about this a little bit around, are we exploring, the potential for outdoor learning? And maybe this is probably a Dr. Hernandez question. And Dr.
I'd like to start.
I think everyone can jump in, really.
Right.
Because I know that we're really working in close partnership with the districts and trying to work with them on helping them develop their plans.
So let me start out first, Mr. Mayor, and then Dr. Hernandez and Dr. Varghese can chime in. I do want to give just a big thank you to our superintendent, Brent Stevens. He's been working tirelessly and supporting the effort of trying to get our children back into school. I'm a parent of a 15-year-old that's here, and I want him to go back to school. And he wants to go back to school. So we are definitely, as a city, working very hard to figure out ways in which to do so. I know our park staff particularly have been engaged to examine both parks as well as campus environments for students to learn outdoors. So that is happening. The superintendent has been working on more than just distance learning. We have been looking at all of the things and all of the requirements that will be needed in order for the school district to actually even apply for a waiver, number one, but also to look at how this can actually occur. So locations aren't our challenge. It's not the issue for us at this time. The resources and staffing will be the challenge for both the city as well as the school district. And those are things that we're going to have to try and figure out and work through. Also, it's also coupled with the requirements under the health order that we'll have to put in place. For example, I know there are a number of things, and I think Dr. Varghese mentioned a few of them. But, of course, everything's going to be approved and based on disease conditions in our county. But they're going to be required to have health screening protocols for students and their staff. They'll have to have plans in place for contact identification and tracing for confirmed COVID-19 cases, testing protocols for the staff, as Dr. Varghese mentioned, and evidence of a partnership with some testing provider, which we'll work very closely with them on. Posted plans for their cleaning, disinfection, and ventilation. And then things like healthy hygiene practices, including installation of hand washing stations, resources come into play then. Also cohorting of small stable groups for all of their activities. And they have to have plans in place for things like physical distancing, including entrance, how people enter into facilities, whether they're outdoors or indoors, the egress, and the movement when they're together. So there's just a number of things that have to be in place. It's just not the location, but yes, we are working on those locations. We are looking at city facilities, especially parks. But again, it's resources, staffing, and of course, all the requirements that I mentioned that will need to be in place in order for a waiver to be approved, in order for our kids to get back into schools. So I just wanted to share that as a start, and I can turn it back over to Dr. Hernandez and Dr. Varghese if you'd like to add.
I want to echo all that Madam City Manager said. It is a complex process. I think that I want to add that as a community, education and health disparities are linked. So when we see these educational disparities where, African American and other people of color are not doing as well across the board in terms of education, well, those disparities are exactly aligned with health disparities. They mirror each other. And unfortunately, those disparities are disparities we've been grappling with for years, and going to online instruction does not make those disparities go away anymore. It makes it even more challenging. And so our commitment, I think, as a city is that we work through this together, because for us, if we're addressing supporting education or we're supporting health, they're all linked. It's all connected. And so we really need to look at how we're doing this together. I think that it's dangerous when we start to have conversations about why doesn't the city do this, or why doesn't the city do that, or why does the district do this and district do that. I think this is the one place, the only way we're going to beat this thing is if we actually work it through together, which was why we have regular meetings. We're meeting regularly with the superintendent and his leadership to problem solve. We participated in a town hall on behalf of the district. Madam City Manager meets regularly with the superintendent. We are all committed to working this through together. And I think it is going to be really productive for us as we think through next steps, that we're just committed together to moving it through as best as we can and as safely as possible for everybody involved.
Thank you. So yeah, I know parents are really struggling to supervise their kids and their learning while also working in many cases remotely. And then moreover, kids of essential workers and low-income families are also, in need of supervision and support. And so this is something we are concerned about. We're working in collaboration with the district on to support their decision-making around if they are going to allow in-person instruction, what that would look like, what the public health requirements and resources need to be put in place to ensure that happens. I just want everyone to know that we certainly know how challenging it is for families, and we're doing what we can to work with the district to support our families. So I think that kind of covered, I think, a whole suite of questions that we got around are we looking at outdoor instruction? There was a follow-up question around are we looking at are we developing plans for childcare learning when weather becomes inclement? So we, right now our Rec and Park Department does provide some limited childcare services in the afternoon hours. Obviously, when we're entering the winter months, weather conditions are going to change. I think this question had asked: are we thinking about sort of how to prepare for when we can't have activities outdoors?
So yes, all of those concerns are on the table, Mr. Mayor. We have to have a plan for both indoor and outdoor, and that outdoor plan, the indoor plan would clearly be needed for inclement weather. Our weather gets really strong and hard. I mean, we have huge winds and heavy rains here in Berkeley, and it would not be a conducive environment for our youth to be sitting outdoors, getting a chill, trying to learn, trying to study, and trying to to focus. So the idea that we start talking even more about facilities. So again, facilities and locations aren't our issues, right now. It's the staffing and the resources on how we have those, because you'd have to be broken up into smaller groups. And so it just makes for a very difficult staffing issue. So yes, I think everything is being thought of right now, and even outdoor right now. If you were to go outdoors with the current smoke issues that we're facing in Berkeley, that would have been a challenge to have our children out there. So we've got to think about every natural disaster scenario that could affect us for being outdoors and teaching our youth. So we're going to continue to push forward. I know the district is committed to working with us, and we certainly have been doing a really good job with them as well, and we appreciate them in being open to ideas and some of the requirements that we're placing out there as a health officer, that we're asking our educational institutions to uphold, and they are right lock in step with us in trying to do that.
And if I could just,
Dr. Hernandez? Just
one little thing just to add for clarification. The childcare or the instruction cohorting language allows for indoor instruction. Of course, outdoor is better. We know that activities outdoors are safer than indoors when it comes to COVID-19 transmission, but the guidance allows for indoor instruction childcare camps if needed. So that I just want to point that out, that that's not a specific thing that needs to be changed. It's allowable right now.
Thank you. There was a question around facial coverings, and this resident says, "While I support the effort to get people to wear masks and citations if they don't, I'm wondering about our most vulnerable populations. Are we making masks available, and are they being distributed to people who can't afford them? Perhaps some of the citation revenue could go towards procuring facial coverings for people that can't afford them, that can't access them." And I think this addresses an issue that's coming to the City Council on September 15th to consider whether to give our health officer the authority to impose fines for lack of compliance with the health orders, it's not just the face covering requirements. Could this resident suggested, could first-time offenders be given a warning and a mask? So, Madam City Manager, if you have any thoughts about that. I know that we are providing
Absolutely.
masks to people. I think our police department carries masks.
We've been providing masks since the order went into effect requiring mandatory facial coverings. And so particularly, we've been providing masks to our unhoused and folks that may not necessarily have the opportunity to go out and just purchase, a box of masks for themselves. So our park staff, our police department, if you go to a city facility or building, of course, they're closed at this time, but if you have business there would be a guard at a front desk or in most of our facilities that would hand you a mask if you did not have one, so you can gain entry for your meeting. But yes, we have been actively providing masks to our unhoused and most vulnerable community members. We, in fact, as we were out just kind of taking stock on, are people really complying with the mask wearing? For a while there, we did some research and a little bit of analysis. We were handing out masks at that time as well. So if there is an entity, for example, our homeless providers and agencies that need the city's help in providing masks, we will support them in providing masks to our outreach to our homeless community as well, because they're out there on the front lines working with these folks too. So we're supporting that mask effort and delivering that type of a resource to our community.
Thank you. There was a question around the curative testing pilot, and does the city intend to make this a permanent partnership? I know from my conversations with city staff, we are looking at continuing it and looking at how we could potentially make it permanent. I don't know if there's anything else you'd like to add, or Dr. Varhus, around the curative pilot project.
So part of that pilot project involved testing that particular kiosk that they had developed, which would make testing it would be very easy to walk up to and get a test and walk away. It was all about accessibility, availability, for example, to be used for the schools starting up. And as part of that pilot, they discovered that because of the open roof situation and the smoky air, that the smoke kind of came into the kiosk, causing both for a very uncomfortable situation for the testers, and also potential damage to the kiosk. And so they're in the process of doing a new beta 2, which should be done within the next 3 weeks. And in the meantime, we are very close to being able to announce going to have a temporary drive-through site using their same method, so that our testing numbers can continue to increase, and so that we can make sure that essential workers and others particularly vulnerable and in need of a test and test results quickly can get tested. And so hopefully there will be an announcement about that in the next day or two. And we do hope to continue to work with Curative. I will add that I have had some interesting questions related to the power of the curative test in, for example, potentially causing a false negative situation. I will say to that I think there's been some misunderstandings in terms of reading of technology, but Curative is a sanctioned testing provider by the Testing Task Force of the state of California. and does testing. They do the majority of testing in LA County. They do a lot of testing across the country, and the power of their test in terms of sort of the general overall power is no different for the most part than what we see in other testing. So I want to reassure the public that we're not testing of COVID testing is very new. And yet they are an impactful organization that has been doing many, many, many tests and been sanctioned by many local state governments. So wanted to clarify that.
Thank you. Lastly, Madam City Manager, a question around homelessness. This resident was wondering the progress of opening an outdoor shelter for the homeless. What is the city doing about the garbage and camping that is accumulating on our streets and in our neighborhoods? And then this resident asked how many of these people are coming from outside of Berkeley. On the latter question, I would say, I mean, I don't think there's been a complete census of all the people that are, living on the streets, but clearly we've seen an increase in people who are on our streets. And so there's no question that some of those are people that may have come from other communities. Some of those are people that may have lost their housing. We are expecting an increase in homelessness as a result of the COVID economic crisis. But Madam City Manager, I don't know if there's anything you would like to update us on around the outdoor shelter and sort of our efforts to very compassionately address the conditions on our streets, which not only involve, offering shelter for people, but also managing the debris and illegal dumping that we're seeing.
Yes, thank you, Mr. Mayor. And yes, we have certainly seen an increase in an uptick in the number of homeless residents that are out there in our community. And it has certainly become a challenge for all of us. We're trying to compassionately figure out how we share space in our community together and how we be good neighbors to one another in that process. So one of the things that we've been doing as a city is we have certainly gone across the entire city, assessed where our encampments are, how those folks are doing. Are there vulnerable folks in those encampments that need assistance and care? And we've also looked at the specific issues at particular sites. For example, in our parks, we've seen an increase in the number of encampments in our parks. For our parks, we are starting to, and we've been assessing them, but we're looking specifically at our parks that have children's programs and recreational activities where this type of sharing is just not compatible. So we're trying to address different health and safety issues and those that are specifically creating, just a kind of incompatibility with the children at the locations, especially when we're finding needles, feces, urine, and that type of thing at a park. Our children have got to be in a safe environment at our parks. So we will be restricting the use at our city parks where there are programs for youth and children. And we'll also be looking at health and safety issues at our parks and addressing those appropriately as well. Across the city, we're addressing, of course, blight, and we're picking up tons and tons of garbage on a weekly basis, where we are driving around with city public works vehicles and neighborhood services staff, and we are gathering garbage. We are also working with our unhoused to say, what of your items that you have out here with you that are not yours, that were illegally dumped, that you do not want and cannot fit inside of your tent? Some of that we are storing for them, and other times we are destroying it for them. So we do make illegal dump runs across the city on a regular basis. Now, in terms of how we're going to proceed, because clearly we've had to decompress some of our shelters. So we don't have the shelter space and capacity that this council has supported and helped us to move folks into sheltered environments. But an outdoor shelter is coming soon. We are working on lifting up a location within the next 30 to 45 days in the city of Berkeley. I don't have a location to share with the public at this time, but we are certainly moving forward. It will be swift and quick, and we will be setting up a managed facility for folks in our community. I don't have a number on how many will be housed in that facility, but we certainly will have security. We'll have amenities for those folks so that they can be safe as well as stay clean. We'll try and have mobile showers and or set up showers for them. We are going to try and put together some type of facility outdoors where we can have more people in an environment than an indoor facility. So work is underway. And but we continue to house folks into hotels or trailers when they become available as people transition to other locations and other permanent supportive housing. So, but we're going to continue to do our best in trying to address, especially the blight in our city. But again, we pick up tons and tons of garbage on a weekly basis across the city. But look in the future to see some huge changes happening at Gilman and University. And I want the community to know that while certainly it isn't the city of Berkeley's property, that is a Caltrans property, we certainly believe that it is still our civic responsibility as leaders of the city to take action and work as hard as we can with Caltrans. As a matter of fact, I just got off a call today with one of the representatives in helping to coordinate how we can address what we're seeing, the growth and the blight that we're seeing at those two corridors. So expect that some change will be coming very soon and very quickly for those areas. Thank you.
Thank you. I just want to address one issue, which is what we are seeing, and this is very clear at University and Interstate 80 and other locations in West Berkeley, is people are taking advantage of the fact that they see people who are sheltering there and they're dumping stuff. And so part of this also is people engaging in illegal dumping, which is unsafe, particularly in this pandemic. So, this is what you see is not necessarily just people who are accumulating objects, but also we're seeing people that are taking advantage of the opportunity to dump objects and debris because they don't want to pay the dumping fees, and so our community needs to respect our city. I mean, we want our city to be safe and clean and livable, and we all have to do our part as well. And we'll certainly do what we can working with Caltrans to address the conditions there, because they are a growing health and safety risk, but we also need to discourage people from dumping objects illegally on state and city property.
Absolutely.
Thank you. Okay, I'm gonna now go to Dr. Hernandez for some health-related questions. First question is, Dr. Hernandez, if you could explain the benefits and hazards of herd immunity. Do we all stop wearing our masks and wait to catch COVID-19? What happens to me, 67 years old, and my 77-year husband? Seems like a dangerous plan.
I would agree. The question is a great question to talk a little bit about herd immunity, what it is, and why it's not a great option for COVID-19. So herd immunity happens when a large part of the population gets infected with a disease, a virus or a bacteria, and then develop immunity from the virus in this case. And then the portion of the population protects everyone else because the disease transmission is either reduced or completely eliminated. So that's kind of the idea of herd immunity. The herd, the group, protects the population as a whole. Why it's not a great, well, there's two ways to get herd immunity. One is as getting the disease and building antibodies, which help protect the person and others, protect that person from getting the disease and potentially transmitting it to others. By either getting it, which is a natural way to get herd immunity, or there's a artificial way of getting herd immunity, which is vaccination, where your immune system is able to produce antibodies because of the vaccine that's been injected most often into an individual. And that person builds antibodies and is immune. And then if many people get immune through vaccination, then herd immunity is built that way. So right now we're dealing with COVID-19, which is a novel disease. We don't have a vaccine yet. We don't know how that vaccine will behave once we get a safe and effective vaccine. So the other option is getting herd immunity by natural ways, which again, we don't know. One, that would put a lot of people at risk. For example, the person who asked the question, just based on the individual's age, is at risk for getting severe disease or complications from COVID-19. So we're putting more people at risk than we need to. And with COVID-19, it's a novel disease, so we're not really sure how long immunity will last and how protective it will be. So because we don't know those factors, the idea of trying to achieve herd immunity by not wearing your face coverings, by going out and socializing with people, by throwing COVID parties, all those ideas are not good ones, because it puts people at risk that don't need to be at risk, and it may not be conferring protection like we would hope it to be. So at this point, the answer, I agree with the person who asked the question. It's a dangerous plan.
Agreed. Thank you. This question was, next question is about reopening of hair and nail salons and swimming pools. And I know that the recent health orders did allow certain activities to including pools, to reopen.
Yes, absolutely. All three activities, hair salons and pools can open, barbers as well. And pools are outdoors only, and hair salon and barbers are indoor or outdoor. All three services or activities have precautions to them. And there's specific precautions that are a little more specific than the state's restrictions. But it's about providing additional protections for those that are either providing the services or receiving the services.
Thank you. Mm-hmm. And as people can tell, I recently got a haircut outdoors, legal way. And now I believe indoor, you can get your a haircut or, or visit a salon indoors as well.
Yes.
Social gatherings. So this resident is asking, can they hold an outdoor memorial service for a family member who recently passed away? And very sorry to hear of your father's passing. They hope to have about 25 individuals. They're wondering, could they do an outdoor memorial service of roughly 25 individuals?
They can. And first, I too want to pass my condolences to that family, the person who asked the question, and to the rest of the family for that individual that passed away. And with this order, funerals and religious services can occur outdoors only. There is that restriction based on the fact that we are in Tier 1. And those services can be held outdoors for up to 100 individuals or 25% capacity of the area. So there's guidance within our order, as well as a link to the state's guidance on places of worship. And there's a section at the last page, I believe, of that guidance, that state guidance, that talks about specific restrictions and some other guidances for funerals in particular. One thing I would say for any religious services or cultural services is that there's no chanting, there's no singing allowed. indoors or outdoors, because we know that that activity increases the risk for transmission significantly. But yes, a memorial service can occur in the way that this individual described.
Thank you very much. Very specific question around testing. How many cycles are run for PCR tests in California? There is clear evidence that tests run at cycles higher than 30 are picking up non-infectious levels of RNA. Would the city consider disclosing information, that information, also information on the number of false positives?
That's a pretty specific question, I agree. And I don't have the answer to the cycles run for the PCR tests. All the tests that are reported by the state at this point are PCR tests, but I don't have that level of detail for the tests that the state reports on. Again, same as the city of Berkeley, there's a number of providers that perform the tests, from commercial providers such as Quest and LabCorp, other hospitals and healthcare systems such as Kaiser and Sutter perform tests as well, and public health labs perform tests. So there's a myriad of labs that perform that. So I don't have that level of detail. And same thing with the number of false positives. I don't have that information to share.
Thank you very much. Lastly, a question around contact tracing and just sort of, the success of contact tracing and stopping an outbreak, and what is the University of California doing to make students comply who live off campus?
Yes, so contact tracing is core public health practice. It's something we've been doing since forever. And it is very effective for interrupting transmission for an individual with their contacts, as well as for outbreaks. We use it for flu outbreaks. We use it for whooping cough outbreaks, norovirus outbreaks, and COVID. So it is very effective. It's one of the best tools to help interrupt transmission. Of course, we need people to be honest and open with the information that they're sharing with contact tracers. First, answering the phone when they see a call from the state or from the city of Berkeley, because it's potentially information that they're going to get to help protect their health. So that's one of the things that it's dependent on. It's dependent on people answering the call and providing comprehensive information. In terms of what Cal is doing to have students comply who live on or off campus, there's a code of conduct that all students are responsible for complying with, and they have to comply with that whether they're on or off campus. If they do not, they are liable for getting punished. And there's a statement from the Center for Student Conduct. There's a specific center that, for COVID response from Cal. It's called, and I'm looking at my phone to give you the actual title. It's called Center for Student Conduct COVID-19 Health and Safety Response. And there's a statement on their web that says, failure to comply with directives to wear face coverings and maintain social distancing can be charged as a code violation. Endangering the health or safety of a member of the university community can also be charged as a code violation. And it also is for the community at large. There's a way for anyone to file an incident report that's on the web. You click on the incident report link, and there's a form that you fill out and basically provide as much information as you can about the incident. The more information you have, the better, of course, but the university is very serious about ensuring that the students are complying and are being good neighbors for the city. So that is one thing that they're doing. Again, we work with specifically the Tang Center to make sure health education messages are out. They're doing a great job. There was a message sent out last week about the Labor Day holiday, directing students not to gather socially. So they're doing a good job. We work with Tang for contact tracing when there are cases in Cal students, whether they're on or off campus. So just to loop back the whole contact tracing question, we do work with the university to do that work, and we tag team that role.
I'll also add that, in my conversations with the chancellor and with the university administrators, that, violations of the health order are a violation of the student code of conduct, and there are serious consequences if students do violate health orders on the university side. On the city side, we have a number of tools that we could use, such as the second response ordinance. If there are large unpermitted events, we can use that tool and declare those events a nuisance. And then obviously the item coming before the city council next week to give the health officer the authority to impose fines is another tool that could potentially be used for very significant violations of health orders. So we've been working with the university to try to get information out to students around the importance of taking very seriously the shelter-in-place requirements and other requirements of the public health orders. I know many Berkeley residents are concerned because we heard of cases of large frat parties that have happened, and an increase in cases. And just want everyone to know that we take this very seriously, and that we do have tools that we can use to also hold people accountable. Those are all the questions I have for you, Dr. Hernandez. I want to address the last set of questions, and one is around the issue I just addressed around citations. Just note that Council's not yet adopted the urgency ordinance. That's on our agenda for next Tuesday, September 15th. If you have an opinion, please reach out to the City Council, council@cityofberkeley.info. But this is an urgency ordinance that would give the public health officer the ability to impose fines for violations of health orders, not just the facial covering requirement. So that is not yet in effect, but there are other legal tools the city has available in cases of large events and other violations. But this question had asked, would the proposed citations for not wearing a mask allow for exceptions in certain areas of situations, such as driving, exercising, walking outside? This individual agrees that mask wearing should be mandatory and enforced inside of stores and other publicly accessible locations, but the risk in outdoor spaces is minimal. You do just want to clarify, you do not need to wear a facial covering if you are alone in your own vehicle. But if you are in somebody else's vehicle, or you're driving with other people who are not in your pod, you do need to wear a face covering. Additionally, if you're on public transit or you're taking a taxi or rideshare, you must wear a face covering as well. You do not need to wear a face covering if you're more than 6 feet away from another person, but we recommend that you have your face covering on you, and you can put it on quickly if you get within 30 feet of someone else, so that you can put on your face covering quickly to protect you and that individual as well. So usually you can wear it hanging around your neck, or dangle it from your ear like I do sometimes, and put it on very quickly when you are coming in close contact with somebody who's not in your social pod. So those have been the requirements that have been in effect from the very beginning, and they still remain the case. So it is essential that you have your face covering with you when you do leave your house. That you must wear it when you are on public transit, or you are in a vehicle with other individuals who are not in your social pod. And the ordinance that's being presented to the council would first, I think, give the city the ability to issue a warning. As my recollection, correct me if I'm wrong, Dr. Hernandez, or Madam City Manager, but I think the city would use this judiciously. I mean, ultimately, our goal's been to achieve voluntary compliance, and not to really be overly punitive or criminalize people. There can be people that don't have face coverings. But we know of cases, businesses and residents who have not been following the health orders. And we have to have some tools for us to be able to protect public health. So really, I think what we're talking about is in the most serious cases that the city would have the ability to issue citations. But I don't know, Madam City Manager or Dr. Is there anything else you want to add about that particular proposal?
Yes, I think in terms of the proposal, no, but just to state that overall, people have done a pretty good job wearing masks in the city. We don't envision or anticipate that there's going to be some mass citation writing out there in the city. I don't think that's going to be the case. I think these are very far and few and in between type scenarios. So we will be using this as a last resort, and that is all.
Yeah, and people have asked, really asked whether we have this authority, and I think it is a tool that we should have, and really use, thoughtfully and judiciously when we need to.
Yeah, because the tool that we do have without it, that's a misdemeanor, and yes, we aren't looking to criminalize folks around this. And I think a lot of jurisdictions have taken that position, that we're trying to rely on compliance, and then this is a step up, a step lower than that, rather, in terms of trying to get folks to comply.
Yeah, I mean, we don't want to arrest people, have them go to jail, but there does need to be some penalty, and we need to be clear to the community about what that penalty is. But I want everyone to know we're not just focused on what are the penalties, but I think we also are focused on how to continue to educate and reinforce the importance of our community to wear face coverings. And I'll get to that at the end of our town hall to share the new poster campaign that we're launching. There was another question around homelessness. I think we did address this in some of the prior questions, but I just want to acknowledge that in recent weeks, we've expanded the availability of hotel rooms, with 68 of the 69 rooms available in Berkeley now occupied as of Friday. With regard to the encampments along our freeway, notably at University and Gilman, we're picking up debris or trash on our property. And as City Manager had noted, we'll be working with Caltrans on addressing the conditions on their property, and while we're also working on expanding services, including an outdoor shelter. So stay tuned for more information. There was also a question around what is the progress of and it's not necessarily related to COVID-19, but I will respond to it regardless. What is the progress of the city's efforts to reimagine public safety? We're going to be hiring a consultant. I think the RP went out today to lead this community process. We're going to be launching the community task force, and then early next year to start sort of broad community discussions around our approach to public safety in Berkeley. There are more specific things that were referred to the city managers, such as looking at our response to mental health calls that our staff is currently exploring. And currently our police do respond in some cases to mental health calls, but oftentimes it's also our mobile crisis team. So we haven't changed the approach yet, but we do have a mobile crisis team that does respond to calls around welfare checks and individuals who are in a mental health crisis. And in addition, we are looking at how we can expand those services to provide additional support and a non-police response to mental health related calls. I don't know if Madam City Manager, anything else you'd like to add on the sort of public safety reimagining conversation?
So yes, we did issue an RFP today here in the city of Berkeley, and We have of course, an internal team that's assembled to help support the community and the council in this effort. We are going to be addressing a number of issues in that RFP. And I don't know, Mayor, did you want me to go over any of those specific things, or are you okay with just moving forward?
You know, what the RFP is going to focus on are the various different proposals that have come from the community and from the city council. And looking at the scope of our police budget and the functions of our police department and how we can, invest and expand in mental health and social services as an alternative for police response. The idea of traffic enforcement and how that's conducted. So all those different things that that you've heard about and that the city council has been discussing, exploring, will all be, part of the work of this consulting team and of the community process that we'll be launching this fall. So those were all the questions that I have. Before we close out, I want to take this opportunity to share a new public information campaign the city of Berkeley is going to be launching to continue to encourage our community to comply with our facial covering requirements. And I want to thank not just our city manager and city staff, but the artist team that includes Alina Wolf, a Berkeley resident artist who helped launch the Berkeley Stands United Against Hate campaign, who've been working with us to not only to develop the design, but to produce these posters, which we hope to get out broadly throughout the Berkeley community. And so I just want to share a few of the designs. So the slogan that we're promoting is "Mask on to move on." That wearing your mask is important for us to move on beyond COVID-19 and to bring our kids back to school, to safely reopen our economy. So as you see here, there's a socially distanced pod of people wearing their facial coverings. And then in addition, we have another poster of essential workers. And so we printed thousands of posters that will be made available at City Hall, at our grocery stores, at our public libraries, I believe, and we'll provide information about where people can pick up those posters. We're also exploring posting of banners in our commercial districts to reinforce the importance of people to wear facial coverings. And while we are focusing on the enforcement piece, we also really want to continue to encourage and impress upon our community the importance of wearing your mask on so we can move on as a community beyond this pandemic and to keep our neighbors and keep our community safe. So stay tuned for information about how to pick up these posters. We encourage all of you to put them up in your windows to help spread the word about the importance of all of us as a community to really continue to be vigilant and to wear our masks when we are outside. So thank you to everyone who helped make this happen, and we encourage the community to help support our efforts by picking up a poster and posting it in your window. So with that, I want to thank our amazing city leaders who were part of today's town hall, and thank the residents who participated and submitted your questions. And before we close, I want to give each of our city leaders an opportunity to say some final words. Go first to Dr. Hernandez. Anything you'd like to share with the Berkeley community?
Sure. I want to share my thanks as well. First to you, Mr. Mayor, for having this opportunity for me to help communicate with the community. I think this is an important forum to have. So I want to thank you for that, and also thank you for the support. As a health officer, getting support from city leadership, especially from the mayor and council and city manager's office is really welcome and in some places unique. So I really want to continue to thank you for that support. It's really important and really helpful in terms of our response, in terms of what we know the city understands how we need to protect ourselves, and having this beautiful campaign is one of those indicators of that. Also want to thank the community for being compliant with the orders and wearing face coverings. Again, when they're hearing that message from city leadership, from the politicians in the community, that also encourages people to do the right thing and to wear face coverings and to social distance. I want to thank my fellow City of Berkeley employees for responding and being able to help support the community with this pandemic. I'll stop there and hand it over back to you, Mr. Mayor.
Thank you very much, Dr. Hernandez. Madam City Manager, any final comments you'd like to offer the Berkeley community?
Yes, just, you know, I know we have a lot of crises. We're faced with a triple threat over the next series of months and weeks. We're looking at public safety power shutoffs, which we've already seen PG&E elect to have public safety power shutoffs in 3 other counties, not our county, but 3 other counties where they're looking at public safety power shutoffs. And then we're still faced with COVID. And the seriousness of all of these 3 major crises convening on us as a city will take our absolute attention and focus, which we will certainly remain focused on COVID, as well as the support to our community around wildfires and preparedness around public safety power shutoffs. Please sign up for AC Alert so that you can be informed right away. And earlier I mentioned a number, and I have that number now. If you receive a phone call from 925-560-5950, please do not disregard that number. And please do not block that number. That is an AC Alert messaging number that is used to contact families to let them know of urgent matters in our community. So I can't express enough that our community is resilient, you're smart, and we are doing an absolutely outstanding job in responding to this pandemic together. So I thank you for all of your diligence and your perseverance in this time, because it's been hard for all of us. But please sign up for AC Alert. Make sure that you go onto the city's website, get prepared. If you don't already have a kit for safety for your families, please do so and start preparing those kits in your homes so that you can be ready in the event that our city needs to respond. So thank you all for joining in on the call. Thank you, Mr. Mayor. And to my public health team, they are so amazing, led by Dr. Varhus. I'm so proud of them. They have just been an amazing group of individuals to help lead this effort, and I'm profoundly grateful. So thank you all.
Thank you, Dr. Hernandez. Madam City Manager,
Yes,
Dr. Varhus, would you like to offer any final thoughts for the Berkeley community?
I just want to thank the mayor and his staff for the invitation to be here tonight. I want to appreciate my co-panelists. And I just want to honor the resilience of the Berkeley community. We will get through this together. Let's be kind to one another. We'll do this.
Thank you so much. So in closing, please continue to be vigilant and shelter in place. If you do leave your house, please remember to have with you a face covering and wear your face covering. And remember to wash your hands. And please remember to follow the public health guidance from our public health officer, which is essential to keep you and our community safe and to allow us to get through this and to help safely reopen our economy, to bring our kids back to our schools, and to help get our community through this. So thank you all for tuning in. Please stay tuned for information on our next town hall, and be safe and have a good evening.